Well, there are no doctors on call at this healthcare summit, and the GOP Doctors Caucus, well, they're sick of it. So far, the members of Congress invited Thursday's bipartisan summit. Pennsylvania Congressman Representative Tim Murphy, the co-chair of the GOP Doctors Caucus, sent a letter to the White House to complain. Congressman Murphy joins us. Good evening, sir.
Great to be with you, Greta.
Okay, you wrote a letter February 19th to the President, actually the President of the United States. What did you say in that letter?
Well, we said here you're working on reforming health care. There's 19 doctors in the House of Representatives, but none of them are invited. And it seems to me, if you're going to do legal reform, you'd have a lawyer there. If you're going to talk about armed services, I don't know, maybe you'd have a soldier there. Perhaps if we're talking about spending $800 billion of taxpayers' money on health care, you might have a doctor invited. But unfortunately, none of us have been invited.
All right, this is dated February 19th. Are you aware of the fact that Republican Congressman Rowe, who's a doctor, wrote the president last August about when he wanted to take the president up on the president's offer to go line by line through the health care bill, and he hasn't even gotten a letter back from August, so...
That makes sense.
I wouldn't hold my breath, in other words.
Well, and before then, I had wrote a letter to Rahm Emanuel. I talked to the president's health czar, and I mentioned the president a number of times. We really want to work on this because there's a massive amount of waste that could be improved in the healthcare system and save money in the healthcare system by fixing the healthcare system, not by insurance issues, not by just having the government pay for it. But we're not touching that yet.
Do you think, though, you do have like a Congressman Cantor, Boehner, and a couple others who will be going on behalf of the Republican Party from the House of Representatives? Do you assume that they're thinking that they will bring your message to the White? You're not.
No, because it's very different. Let me explain this, because it comes down to this. When, for example, in the president's proposal, when he talks about waste, it's accounting methods and it's oversight for fraud, etc. That's not what we're talking about. 95% of Medicare spending is for chronic illness and 75% is spending overall. Of that money, there's huge disparities in what's done between doctors and hospitals and regions in terms of how they treat illness. And those differences can be in the hundreds of thousands of dollars per patient for illness. But only about 4% of that variability has to do with the disease severity itself in certain regions. We should be.
What's the rest of it?
Well, it's just differences in how doctors treat patients. And so it may end up as more hospital days, different kinds of treatments, etc. And so how do we get us focused again on clinical standards and protocols designed by the Academy of Pediatrics and the College of Surgeons? So you really are working on what is the best approach. But what Medicare and Medicaid, and I say those examples because that's what the government pays for, they'll pay for procedures and tests and days in hospitals, but no one pays for coordinating the care for chronic illness, to helping to make sure the patient is following through, that they're getting the prescriptions they need, the doctor's getting the data that they need, the information's coming through.
It's efficiency, essentially. Are you talking, it's somewhat, isn't it inefficient?
Well, it's
clinical efficiency,
but it's also focusing upon using clinical standards, doing the right things for the patients instead of the wide variability that may exist.
If that were done, do you make the assumption that would reduce costs? Because forget the quality is one issue. I mean, obviously, I can see the quality of having someone follow through on your care, but can you put a cost number on that?
Yes. The New England Institute for Healthcare estimated about $700 to $800 billion
would be saved on that
per year out of a $2.5 trillion system. Now, when we're looking at waste, fraud, and abuse in Medicare, about 10% or less of the cost. If 95% of those costs is chronic illness, shouldn't we focus on managing chronic illness better? But the proposals don't talk about that. As a matter of fact, when they talk about cutting $500 billion out of Medicare, a lot of it comes from Medicare Advantage. And what does Medicare Advantage do? Well, it manages diseases, but that's zeroed out.
Well, Congressman, good luck in answer to your letter, but you might want to talk to Congressman Rowe before you start sweating not getting an answer.
Well, we'll keep working on this.
Thank you. A lot of letters go back and forth between these two places, but I don't see any answers. Anyway, nice to see you, sir.
Thank you.